not change anything about the paper, but kind of take DEI out.
Today we're going to talk about Palestine.
This is the American Psychological Association's annual conference. You'd think they'd be focused on training attendees to become better mental health professionals. Instead, they're focused on identity politics.
If they want to do some activism around this while teaching.
So part of how I do it is I try to think about what's the class and the topic that I'm covering. So for example, this fall I'm teaching the DSM class.
Yeah.
So in the class, I will do case studies. You can just make one of your case studies be a client that is dealing with some of these issues. So you can still they might be trying to diagnose for depression, anxiety, but part of the assignment is to, from an ethical standpoint, from a multicultural standpoint, how do we address the concerns that are coming up for that client? You might ask them to do some research to bring in some background for that particular case study. So that's how I do it. The issue in Kentucky is like viewpoint diversity and those kind of things. It's like, well, if I embed it within a clinical situation and connect it to our values as counseling psychologists, then I have a much clearer path. But I almost always, week 2, usually week 3, week 1, we talk about ethics.
Okay.
Week 3, we talk about multicultural issues and talk about how ethics link into multicultural issues and why counseling psychologists need to deal with these issues. And you can just integrate that as part of the story. So rather than, today we're going to talk about Palestine.
The conflict between Israel and Hamas has led to a lot of conflict within the APA. Members report being harassed at APA events because of their Jewish faith. Allegedly, a former APA division president taught that Zionism is a mental illness. She referred to Israelis as genocidal f***s, and after the October 7th terror attack, wrote that Hamas terrorists were martyrs.
When you start having your case studies or you start having readings, then if someone wants to challenge it, you say, well, you actually are challenging our values as a whole. You actually are challenging what APA has said we need to do. So I start with that so that when they want to press that, it makes it more difficult for them to do that. And, and I usually just use the APA Ethics Code, the APA Multicultural Guidelines. So there's a lot of different sources. Exactly. You can do that same thing. So everybody has some kind of statement that talks about, even just the Ethics Codes.
Inclusive something, even though they're taking that word out. You know.
We've seen what happens when you leave radicals like this in charge of a university. Why should they ever be in charge of anyone's mental health care?
During the course of writing, a lot changed. A lot of it moved, and we had to sort of rewrite our grant using the non-triggering language. I have a protection of tenure, and so I recognize that puts me in a different position. So one of the things I've been thinking a lot about is sort of where my line is, because there's been a lot of talk about, well, I got advice from people. We'll just change resources. Or why don't you focus more on this part of your research and not that part of your research? I'll speak to examples. I was working with a postdoc, and she was the first author on a paper, and we had DEI in the title because it was about how people view DEI efforts that faculty engage in. That is the topic. Would you mind if I just use the title because we're looking at my CV? So not changing the paper, but kind of take DEI out. And I said, yes, I wouldn't do that for myself. I said, yes, I want you to be supported because that's what I think. It's different to change the word, why not? But I do think it's important if you can push back and do that protection. And you feel it's important to you, which I do so. So that's been sort of one of the things I've been thinking about. So the language changes. I also don't think language changes. I think it's there. I think the people who are against what researchers are doing are against the content, not the word. So I don't, if we're going to make all these changes in scientific that effective.
At Accuracy in Media, we've exposed divisive DEI initiatives in schools and universities across the country. We've shown the horrible impact this ideology has had on education in America. Well, now the cancer of DEI is coming for our healthcare system.